Well, every year, unfortunately, in every country of the world, millions of people suffer stroke, suffer traumatic brain injury. They suffer from other brain lesions like, focal infections and so on. And all these people, once again, that's millions of people all over the globe, do not know whether one day they will experience seizures. And the probability of seizures after brain lesions is quite high. For stroke, for instance, it's about 10% of stroke survivors. And the problem is that it could occur next day after stroke. It could never occur at all, or it could occur, for instance, 5 years after the traumatic brain injury. And once you have one seizure, there is again, even on treatment, an uncertainty about your future, about treatment efficacy. And you don't know the predictors of their epilepsy after the traumatic brain lesion. So once again, it's a huge burden in terms of the population, in terms of quality, in terms of mortality, as seizures after traumatic brain injury and after stroke contribute not only to disability and to poor restoration after stroke and TBI, but also to mortality. And for instance, we have data that about 20% of patients who suffer early seizures after stroke eventually die. Once again, early seizures, for instance, after traumatic brain injury and stroke, contribute significantly to mortality, and unfortunately it's under-recognized in the population, as in the community the burden is attributed to stroke, to TBI, to other focal lesions, but the role of epilepsy and seizures unfortunately is underestimated. There are a number of beautiful studies performed in different centers all over the world that documented the high prevalence of comorbid disorders in epilepsy, especially in focal epilepsies, especially in epilepsies that occur after acquired brain lesions. And just to name a few, it's depression, it's psychosis, it's pulmonary diseases, it's cardiovascular diseases, it's diabetes. Some of them have the causal association. For instance, stroke is one of the main causes of seizures and acquired epilepsies. However, there are a number of comorbidities with the unknown association. However, they may have the same pathways, the same signaling system, like inflammation, for instance, or the level of neurotrophins or some others. And it's very important to understand the signaling system and the causality of the comorbidities and epilepsies occurring after acquired brain lesions, as sometimes these comorbidities do not only decrease the quality of life and impair social well-being of the person, but also they might contribute to the severity of epilepsy and impair the prognosis. Also, it's a very important social issue, as it was documented that patients with seizures and epilepsy after brain lesions have much more visits to doctors and requires much more other resources from the healthcare system. And in case it's needed, these resources should be allocated, but the burden of these epilepsies is extremely high. Also, currently, unfortunately, we don't know how to prevent epilepsies after the brain lesions, like after stroke and after TBI. There are many trials by existing molecules. However, there are promising signals that not necessarily anti-epileptic drugs, but also medications from other areas of neurology and psychiatry or internal disease could be beneficial, but it should be investigated in appropriate large-scale trials.